Welcome back to the vlog.
Yeah, welcome.
First video I ever did, I talked about the calm before the storm because I started the vlog just as the coronavirus was coming into the UK. I think we had a few cases at the time. But now we're very much in the eye of the storm.
Very much.
The trough after the first peak and kind of a time to reflect back, I think.
Yeah, it's that disconcerting silence, isn't it, at the moment, where everything's gone quiet, everyone's a little bit bored of coronavirus, and people aren't really social distancing as much as they were. And I think there's some people out there that think this is over, but for many of us in the health industry, I think we're slightly worried that this really is just a little breather before we do it all again.
On that note, have you had a chance to reflect on the first wave? Have you had a chance to take your breath, get your breath back?
Yeah, the last couple of weeks I've been doing that, and I think it's been quite necessary because there's so much stuff to process with all of this. There's the huge amounts of death and suffering that we've seen. There's the effects we've seen on the whole of society with social isolation, loneliness for some people, inability to see friends and family. There's not a single person that hasn't been profoundly impacted by this. And we've had to deal with not only our own feelings about it, but those of our patients, our families and friends. You know, you always become a bit of an expert, don't you, when you're at the coalface in these things.
That's it, very much so, even though life has been more normal for us than a lot of people.
Yeah, we've still been going to work every day, leaving the house.
Financially, we've been more secure than a lot of people, particularly thinking about the future and the uncertainty. One thing I wanted to pick up on that you said was the kind of number of deaths we've seen. So how... just in terms of relative to the number of deaths you see in ICU, because obviously you are an expert on dealing with death, because not every patient is going to make it when they come to ICU, although patients that go to ICU are ones that do have a chance of making it. What's the kind of relative?
So I think we've seen about a 3 to 5-fold increase in the number of people dying on ICU that we would normally expect to see at this time of year. Normally in ICU, about 11% of patients die. And unfortunately with COVID, we've seen that as nearer 50%, which is difficult because we believe that we're trying to help people. We have to have some belief that we're able to make people better, or else we wouldn't be doing this job. And it's been a very frustrating journey to watch so many people die, and to, quite frankly, just not be able to treat them. I mean, where are we now? 6 months into this process, and we are no closer a treatment than we were 6 months ago. We have more understanding of the disease, but we have no vaccine and we have no treatment still. All of the care that we're still providing is supportive. It's just buying time while the body fights the virus or the immune response. And
also on top of that, it's not like we have drugs that we think are kind of ready to go either. All the trials we've seen, even the initial things, are not this wonder drug, are they? They're at best an adjunct to...
I think we need to be very careful not to jump on the bandwagon. So there are certain people out there in the world who've decided that a drug might be a good idea to take it, and then subsequent trials have shown actually a worsening of outcome, for example, with drugs like hydroxychloroquine. So we haven't yet seen any wonder drugs appear. One of the things I think we've done really well in this outbreak is we managed to get together national and international trials really quickly. So we've recruited, I think, about 7,000 or 8,000 patients into the UK trials, looking at which of these drugs might be beneficial. And to get that number of patients recruited and into the limbs of the trial and the data being looked at so quickly is phenomenal. It normally takes 2 or 3 years to get something together that big. We're waiting on the results on that. I don't think we're going to get anything immediately, but we're learning early which treatments are not helping. Perhaps the ones that might help, I think we're going to need more information on.
And I guess that kind of leads on to the point of what are the kind of positives, what are the things we've learned from the first wave? I mean, that is certainly one thing that a huge positive, not necessarily in my work, but in what I've seen, is I didn't think the NHS and also the general public were quite as capable as adapting as much, as quickly as they have. And I know we're now seeing the strains of that, but the sweeping changes we've seen across the board.
It's been incredible, hasn't it? I mean, the red tape that's been cut through. The NHS has adapted incredibly well to be able to increase your ICU bed base in some situations up to 7 or 8-fold from your baseline unit. Certainly in our unit, that involved training up hundreds of extra nurses and dozens, if not 100 extra doctors. Which is no mean feat in a few weeks, but it's been at a huge cost. I mean, basically the way that the NHS has coped is because it stopped everything else.
Yeah.
So all routine care has stopped, and we need to get that routine care up and running again. But how do we do that when this virus is still out there? Because the last thing you want to do is start doing big operations on people, bring them into an environment that clusters cases, like a hospital, and then give them COVID.
And we already have seen the adverse effects of that, where we were doing the normal surgery at the beginning of the crisis, weren't we? And we've seen people have much worse outcomes.
Yeah,
as you'd understand. Yeah, understandably. Yeah.
There was a paper in the Lancet last week that 25% of patients who underwent surgery during this period sadly died. Now, that is way more than you would expect normally. So we need to look to ways that we can safely start getting some of the normal NHS work up and running, because otherwise we are going to be in a situation where more people are dying of non-COVID related ill health than from COVID related ill health. In most cases, planned surgery really did stop. It's now starting up again, but for example, in our hospital, we've set up a completely different entrance to the hospital. There's an area from which you don't go out during that day to other areas. So there's an isolated group of staff looking after those patients. But we're still in a situation where we've got these silent spreaders. We've got people out there who have coronavirus with no symptoms, and that could be potentially at times quite a large number of staff.
Yeah.
And if that's the case, then we need to be very vigilant in not... The staff become a risk to the patients.
Yeah.
So screening will help, but even if you did screening every week, you're still going to miss people.
Yeah. I mean, I heard in one sort of cohort of healthcare workers, it was about 50% of them were tested positive at any one point, asymptomatic.
Yeah.
So that's huge numbers, and I know we are doing ways to mitigate that. Obviously, we all wash our hands. We're all wearing PPE. That's as much to protect us from getting it as us from spreading it. We have temperature checks before we go into hospital. We obviously wash our hands at the entry point to hospital. But even with all these things, we're going to get people in that are vulnerable, because people don't come into hospital if they're well.
Yeah.
And we are the people that are likely to be spreading it.
And there's a huge backlog of cases that need doing. And as anyone who might have tried to make a dentist's appointment will see, because you need to clean in between each patient, same in an operating theatre, your productivity goes down massively. It may be that we're able to get half of the cases that we would normally be able to get done in a day in an operating theatre, or maybe a third. So it's very difficult to see how we're going to be able to catch up when there's the work that needs to be done, plus a 3-month backlog, plus everything that's stacking up now for the future. It's going to take a lot of thinking about to try and work out how we do this safely. And all of this whilst we're in the eye of the storm, because COVID hasn't gone away.
So at any point we could then have another surge, can't we?
Yeah,
then suddenly we've planned all these operations, and then we have to flick to a different plan, don't we?
So we talk about pandemics, right? That we're in a pandemic, a coronavirus pandemic. Well, the next word that needs to get out there in people's vocabulary is endemic. Okay, so endemic is when a virus or a disease becomes embedded in a community. It's always there. It just comes in peaks and troughs. For example, the flu. And I think there's no doubt now that coronavirus is endemic. And as such, it isn't going away. What will change is more and more of us will become immune, either through getting it or through vaccination. Ways that we can treat it might improve. But coronavirus is here to stay. So, we're not going back to the way things were. We can all see, you go to the supermarkets and there's lines on the ground and people have to queue, and life really has changed for us. And somehow we've got to ride these peaks and these troughs so that when it's safer, and I don't use the word safe because there's no such thing, when it's safer to go out, we're able to go out and socialise a bit more. But as soon as we see rates going up, then we're in lockdown again. Ditto, we may have periods in the hospital where it's safer to do some elective work, some planned work, and then other times, as soon as we see the cases start to rise, we're going to have to lock down again and again push all of our resources into intensive care and respiratory medicine to make sure that if people get COVID and get it badly, there's a bed for them and staff to look after them.
I mean, we talked a couple of times about the number of people kind of getting restless and not adhering to lockdown. But I think what you touched on there is a lot of people are kind of the other way around, where they're scared to go back to normal life, waiting for it to be safe. But as you're saying there, it's never going to be safe. It's either we have a degree of risk in all our lives, even just getting in the car and driving somewhere. So we have to, this COVID is going to be part of our daily risk now. So we have to look at how we interact with the world. And at times where it's in high prevalence, then we have to use more adaptions. In times where there's lower prevalence, we're probably going to still have to change the way we live, at least for the foreseeable few years, right?
Yeah, I think so. I mean, track and trace will probably help because it will give us an idea more of what's happening in our own towns, for example. So it's all very well London having, a peak, but if there's not one in your own town, then that might mean that the responses necessary are different or lesser at that time. But like you say, I mean, some people are terrified. They're sitting at home and they're becoming agoraphobic and are really fearful of the outside world. One has to balance that with risks of staying inside. It's not good for your mental health. And I think that the government have identified that early with trying to get everyone they could out there exercising. It's not good for your cardiovascular health. If you're sitting on the sofa the whole time, then, and even if you're out exercising once a day, that is not the same as going out there, going to work every day, moving around,
You can do that for a short term, can't you? But in the long term, also without going into too much detail, we've seen a couple of deaths directly as a result of this lockdown, not to do with the actual virus.
Perhaps some of the saddest cases that I've seen during this have been the cases that you can directly say healthcare has failed someone because it's just stopped during this time, and that can't be allowed to happen. We have to find the safest ways possible to continue care for people, but also, dare I say it, we have to keep the economy going, because if nothing else, the economy pays for the NHS. And I know there's a lot of concerns about getting back into the workplace, getting schools open again, but unless we start generating some money, it isn't going to be long before the NHS runs out of money and there's nowhere to be treated. So,
it's definitely a consideration. I think the government, if there's one thing we can sort of empathise with the government, is that as doctors we often get judged on things where people don't really understand what we see and what we go through. So we can get judged on decisions of things in the heat of the moment and things like this. And I can totally see that from the government's point of view. And it's very difficult for them to come out and overtly say, we need to start looking after the economy. They have to do it in a subtle way at the cost of increasing the risk on people. Because how we can never make the risk zero, but we can make it close to zero by just saying everyone to stay in your homes for good. But then ultimately, where does life happen, and where do we then where do we generate money? Where do we then able to look after each other in terms of, you know, generating money for the welfare state and for healthcare? So,
I mean, it's the two are so interlinked, and like you say, no prime minister or treasurer can stand up and say, you know, we have to prioritise the economy right now, but you know, at the expense of lives. Well, actually, you know, we need the economy to save those lives, and like you say, I mean, I don't think any of us envy the decisions having to be made by those in power at the moment. And I have to say, I do get a bit annoyed when I hear in the media this question again: is it safe? Is it safe to open schools? Is it safe to get on a train? Is it safe to go back to the office? What's safe? The world isn't safe. You can trip over, or you can prang your finger on a sock at any time. You know,
I can vouch for that. Yeah.
It's not safe to stay at home.
yeah. I've modified my no socks anymore.
No socks. No. Yeah, I'm sockless today as well. Yeah, but that's you know, we have to look at minimising risk, not making it go away. I mean, wouldn't it be great if COVID wasn't here and coronavirus never happened? Well, yeah, of course it would. It'd be lovely. But we've got a disease that's now endemic, and we need to get to grips with it.
How do you think the government have handled it in general? We don't have to put this in, but
I mean, I think it was a huge shock to the government and to Boris Johnson and to the country when Boris became unwell enough to need intensive care treatment.
That's where all bets were off for me in terms of when a news article flashed up. I was like, what the hell? It did feel like we were in, at that point, a dystopian film. It felt like that the whole way through. But as soon as Boris Johnson got admitted to hospital and then ICU, you know, it was just like, what is going on?
But people have very short memories, and I think that it's been lovely to see the support for the NHS out there, and the clapping, and how passionately Boris spoke of the people that looked after him.
Naming his new baby after a couple of the healthcare
That's great, Boris, but you know, there's still that £350 million on the bus, and quite frankly, you know, it's all very well being appreciative, but we've got to fund the NHS. We've got to look after our doctors and nurses who are front line in this, and our porters and our cleaners, and many of whom come from overseas, some of whom have got caught in, you know, financial traps related to coronavirus.
I think that's another positive thing. It has put the highlight on to the NHS. I think people in Britain have always been very proud of the NHS, and I always do feel that of patients, particularly ones we help. But I think this has put a spotlight on, and I think reinvigorated that love. But then again, I know a lot of people, I talked about it on the channel before, about the clap for carers, how that does feel a bit empty unless it's followed up with actions. Okay, I really like the clap, lots of people do, but I know a lot of people think, well, okay, you know, for want of a better phrase, put your money where your mouth is.
Yeah, we're heading into a recession or a depression, and there is no doubt we have to pay for the last few months in some shape or form, and that's going to be through tax rises. So actually, you know, the public love the NHS. Do they really love it enough to pay out a little bit more tax for it? Well, let's wait and see, shall we?
I mean, the other thing that I didn't really like about the government's response was really how I still feel like they're playing politics. They have the inability to say something's gone badly. You know, when they miss things, it tends to be spin and deflecting or not answering the question. Like, as a doctor, do you think we do that? Do you think when a patient says to us, why hasn't my scan been done today? We say, oh, because, well, we've done this number of scans today, and we don't. We just are honest and say, this is why it went wrong. This is what we're going to do about it. Apologise if, you know, and communicate that. I wish the government just did that, because then I feel like we'd know a little bit more where we stand and where we're going.
Well, in the early days of this, there was some really good cross-party working. So, you know, Labour came straight out and said they were not going to put forward alternate plans for lockdown. They were, you know, fully committed to what the messages the government were giving out.
It's like a war room cabinet, wasn't it?
And that was great. You know, we had a common enemy. the enemy was coronavirus. Actually, we still have a common enemy, but I think people are starting to forget that now. And now there's all kinds of other enemies who like to drive the cars to test their eyesight, that kind of thing. That please don't do that. Please just don't do that. It's everyone to start with had this common enemy. Now I think people are looking for someone to blame, because life isn't pleasant. People are losing jobs, they're losing their lives. And we're not going back from this. And I think we're seeing that around the world. There's a lot of discontent. Compared to other countries in the world, I would say that the government has safeguarded people's incomes in the vast majority of cases. I know there's some self-employed people who haven't quite had the same support, but the furlough scheme here, that hasn't been replicated in countries around the world. And you see people, in America in lines for food banks and things, middle-class people who've just lost it all.
I don't understand how they're coping.
No.
I mean, I haven't really seen that voice come through, because in the UK we're very lucky with the furlough scheme. But like you said, we're going to be paying for that for a long term. So maybe America will come out of this a lot quicker, given the fact that they've not taken on this burden of the furlough.
40 million unemployed, that's like about a third of their workforce or something. There's a lot of hardship on the way. And I think one thing we have managed to do more or less in this country is keep social order. And I think that there was a real risk that, and perhaps we're seeing it around the world, that there's a lot of discontent out there. And there's very, very valid reasons, as I say, why people might want to feel that they need to take to the streets at the moment. But coronavirus is still here. And if the message is we stay apart to save our lives and save the lives of our loved ones, that extends to demonstrations as well. And it extends to the tube train, and it extends to visiting castles. We've got to do this.
In some degree, we're all expecting some kind of second wave, whether that be a kind of much flatter, like you say, an endemic type picture, or one, some people thinking it could be as bad as the first one. And some pandemics do have that shape, don't they?
Yeah.
So how do you feel personally now? Do you feel ready for the next? Have we got things in place? Or
not really. I think we proved we were able to do this very quickly, and we've trained a huge number of staff. So we're in a much better starting point, and one imagines that PPE is still being produced during this eye of the storm, and that therefore stock levels will be more reliable for the next surge if it occurs. We're using this opportunity at work to reflect a little bit, to do mortality reviews, to look at the care that we provided for patients who didn't survive, and seeing whether there's anything we'd do different second time around. And that might be reconfiguring new ICUs, it might be expanding existing ICUs, it might be looking at who should go to ICU. Did we get that right first time around? And I think that we've got to learn from experience, and we owe it to the public to look at the things that went well last time around and the things that went badly, and look at trying to change them. The concern that I've got is that first time around, all bets were off. Red tape was just ripped up, and we said what we needed, and it happened.
It was very much clinician focused, wasn't it? The power was given away from the management, which typically in a hospital, to some degree, clinicians and management come together as a negotiation there. But in this, it was very much like, what do you guys... Because it was an ICU and general medical ward problem, wasn't it? And so it was almost, what do you guys need?
And then we got it. Is that going to happen next time around when we're trying to prioritise getting back to normal work as well? And again, we talked about the difficult decisions that the politicians have to make. Well, the hospital managers have to look at, do they plough all of their resources into a small number of beds on ICU, or do they use those resources to get everyone through clinics? And they have to make those judgments as well. But I do worry for the second round, and possibly the third or fourth or whatever, that the resourcing may not be quite as forthcoming as it was first time around. But
I think it's a harder challenge. I think you, just in terms of, you can do anything based on, kind of running on adrenaline, all hands on deck. But then ultimately, how do you sustain that? How do you put those things in place? And not only that, we've got everything to catch up on that we've kind of taken our eyes off. And then we have to put, long-term strategies in place to deal with this. And that's a real challenge, I think. I think we've reacted really well in this first wave. I know there's been a lot of deaths, and every single death, that's a family that will reflect back on that first wave. Not like necessarily I haven't lost anyone close to me, thank goodness, but I look back on quite proud of what we've done, managed to rise to the challenge, but other people are going to reflect back on that, and that's the time they lost someone close to them. It's a totally different way, totally different outlook on things.
And it's been a cost. It's come as a cost for all of us. I think it is fair to say that we're quite knackered as a workforce at the moment. Half of the NHS workforce have been at the front line treating COVID. The other half have perhaps been trying to work more laterally and work out how they can deal without patients by video conferencing and whatever. But there'll be a lot of people out there. There'll be a lot of surgeons sitting around going, "Come on, it's time to start operating again."
Of course.
Yeah, it is. But also, in order to operate, your patients need to be asleep and your anaesthetists are knackered. So I don't think this is something that we're going to get over very quickly. I think doctors, healthcare workers in general are often quite resilient, but this is stretching our resilience. And I do just hope we get a bit longer to try and relax a little bit, recover from this before round 2.
All right, Sonia, thank you so much again.
You're welcome.
Joining us.
Yeah, you're welcome. And a little bit of reflection time before we hit it again.